Okay, so moving on to my next video, I'm now going to be doing my epidural insertion. So first and foremost, I would make sure that I do a pain assessment on my patient, and my patient states that she's in pain and that she would like an epidural at this point. I would go ahead and reach out to my doctor, get the doctor's orders. Prior to administering an epidural, I will make sure it's super important that I bolus my patient with fluids because epidural can cause hypotension. At this point, I would have all of my labs, make sure I have a CBC done, white blood cell count done, all before I get my epidural inserted into the patient. She's going to be sitting up on the bedside, which I have her doing. The doctor's going to go ahead and I'm going to turn her this way. And I'm going to let her know that what the doctor exactly is going to be doing, but on her back it's going to be some betadine here, and it's going to be a pressure sensation feeling going in. It's not necessarily pain of where the actual epidural catheter is going to be inserted. So I would go ahead and make sure I make my patient aware of that. And that's what the physician's going to be doing. So she's sitting up on the side of her bed. Her O2 sats are going to be being monitored throughout the procedure, making sure she doesn't desat. So she's got her sitting up. It's always best to be very mindful to keep the patient comfortable as possible. So that's my job in this. I'm going to be assisting with keeping her comfortable. She doesn't have a spouse or anything there to console her or to lean on or anything. So it's super important that I provide that for her. So I've got her sitting up in the bed, sitting on the side of the bed. She's going to be leaning up and she's going to be arching over so that the doctor can have a great view of the back. Okay? So once that's done, I'm going to let her know she needs to take the deep breaths. My physician has made it to the room and he's ready to go ahead and insert it. So I've already got my tray set up with my gloves set up and everything. So now we're ready, and he's going to go ahead and insert the epidural. And I'm just monitoring her breathing. I can go over do some breathing exercises with her as this is being inserted. Now that the epidural has been inserted, so I'm just going to stay with her, and I'm going to make sure that her vital signs stay stable, as well as the baby's vital signs stay stable. They will both be connected to the monitor, so that we can monitor their vital signs, their heart rates. So now that that's done, once the epidural is inserted, once the epidural has been inserted, it's going to she's going to need a Foley because she won't be able to get up and down to go to the bathroom and to go ahead and void. So it's super important that another thing that we empty the patient's bladder prior to doing the epidural. And it's super important to try to keep the patient's bladder emptied as much as possible. That's the need of, that's what the Foley is going to be there for. To make sure there's no pressure on the baby and from the bladder and from the placenta and the sac that the baby is in, that there's no extra pressure on her bladder. So we go ahead and insert the Foley there, and that is it with my epidural insertion.